o'clock. I want to thank everybody for joining me tonight. My name is Ginny Williams, and I am the CEO for Curry Health Network. Under normal circumstances, I would probably be holding live town hall sessions with you, but under the given circumstances of social distancing, I'm unable to do that. So I've decided to start a live stream video every Friday night at 6 p.m. The format, because I will have a hard time monitoring questions as they come up. If you're viewing me this evening and you have questions, please submit your questions on our website in advance. I have a couple of pages of questions I'll be addressing tonight from folks that submitted questions in advance. So I'll be sure to cover those questions. And then any questions that come in through the week, I will take up next week on the live feed Friday night at 6 o'clock. So without further ado, I do want to sincerely thank you all for joining me. I've got a lot of information to cover and a lot of questions, so bear with me. I plan to get to all of the questions and topics at hand. First, I just want to give you an update. We had a lot of questions about testing for COVID-19, and I think everybody is aware that the country as a whole has suffered from a shortage of these tests, and Curry Health Network has been using and continues to use the Oregon Health Authority's guidelines as it relates to who should be tested. You can look those guidelines up, but essentially an individual needs to be symptomatic and then be part of a defined group of folks, for example, a healthcare worker or an individual over 60 or an individual with worsening symptoms. And so we continue to follow those guidelines. However, I do believe, as been promised by our government, the testing is becoming more available. Curry Health Network did receive about 1,500 test kits in the last week, and we will be rolling those out to CMC starting on Monday morning and continuing to collect at the hospital going forward. Those tests are submitted to a reference lab called Quest in Southern California. And we're seeing turnaround times of those tests to be about 3.6 days from the time we send it in. That doesn't mean since inception, since we started testing, that's been our turnaround times. We've seen delays as much as 14 days, and I think that just had to do with the reference labs being overloaded. In addition to that, Curry Health Network this week it received one of 3 testing machines called the Abbott Now. That testing capability is a rapid testing station that allows us to receive results within 15 minutes of a test being taken. However, Oregon received very few supplies of the testing kits that are used in that machine. Curry Health Network did receive about 48 of those kits. Some of those kits need to be used to test the machine and make sure that it's working accurately, and we need to use some of those tests, unfortunately, to train our staff. So not all 48 will be available, and I don't know the exact number today. Our lab is working with our pathologist to understand how they could streamline the verification process or validation process and getting our staff trained on that. We intend to use those tests for patients that are hospitalized and or for first responders or healthcare workers that have potentially been exposed in a high-risk situation. Otherwise, we'll continue to use Quest Lab for outpatient ambulatory patients that are exhibiting symptoms, and we'll, of course, be asking you to self-quarantine until such time as we get the results back. There's been some confusion recently about testing and how those results will get published. Essentially, we receive the test results back from Quest Laboratories today, or when we do rapid tested, we'll know internally. When there is a positive test, your provider will be contacting you first. Simultaneously, we will be contacting public health, who will report these positive tests up to the state, and you could expect a call from the public health officials to do the surveillance that's required, meaning understanding who you live with, who you've come in close contact with, so that we can have them self-monitor for symptoms going forward as well. To date, we have collected 80 tests at Curry Health Network. We have 11 tests that are pending. We've had one positive test, and we really do have the capability to test people as necessary, but again, according to Oregon Health Authority's guidelines. Those guidelines do require that an individual test negative for influenza before we test for COVID. However, we do expect those guidelines to be changing here as we leave the flu season and we enter into the spring and the summer months. So I think I've covered a lot of questions that were related to testing. I can't answer necessarily total county numbers. That's really for public health and Oregon Health Authority. I do know there was a discrepancy where we had 3 positive cases in our county, and Oregon Health Authority's website was only showing 2. But in conversation with Cherie Ward, our public health officer, she has gotten that rectified with Oregon Health Authority. So rest assured, the 3 that is on Oregon Health Authority's website are the 3 that we were confirmed on Sunday evening around, we were informed about 6 p.m. Now I'd like to just talk to you a little bit about the impact that this pandemic has had on Curry Health Network, and I would mention to you that we are not alone. Rural hospitals have been particularly hit hard because when social distancing requirements were put into place, restaurants and others were closed. We also received an order for the governor on March 17th that we were to cease all elective procedures. At the same time, we were being asked to shelter at home. Which is, I commend the governor for making those very tough decisions, being in the position I have been in the last few weeks. We make decisions that are not necessarily popular, and they're very difficult for us to make, but they are necessary for the good of the whole. Unfortunately, for the individuals, it can be very, very difficult. So the impact to our volumes, although I don't have specific numbers, I can tell you in March, they were at the latter part of March, they were significantly declined. In April, we're seeing even less. For example, at Curry Medical Center, yesterday we saw a total, actually I think with all primary care, including Gold Beach and Port Orford, we saw a total clinic visits of 45. And in previous months, our averages would be more around 100 and our highs would be about 140. So that's just one indicator. Our emergency room visits are significantly declining too. And so it is having an impact on our revenue substantially. And I'll get into the financials in just a little bit and give you some glimmer of hope as it would relate. But because of the financial situation that we found ourselves in, we have been needing to make very significant and very painful decisions as it would relate to our employees, who we consider family. Often they are our friends, they are our neighbors, and they are important to us. And so we have gone into a significant cost reduction plan that would include certain positions being eliminated. Other positions, we're asking staff to, or we're placing them from a full or a part-time position into a per diem status. That allows that employee to be eligible for unemployment, whereas prior to us doing that, we were just sending them home early and their paychecks were half of what they would normally receive, or they would have to use their PTO to subsidize the hours that were lost. So by putting them into per diem, they are eligible for unemployment. As it would, our management team, the entire admin team and management have voluntarily taken a 20% reduction in pay. And as it would relate to providers, we've had a number of changes in contracts. I will say that unfortunately, Dr. Adams tendered his resignation back in February, and his last day was March 27th. And while we were planning to reassign patients according to zip code with providers that we currently had in network, COVID hit, and I apologize to everybody that you have not received a notice of who your next primary care provider would be. Dr. Nelson is another physician, a wonderful person. We will miss her dearly. She determined that a per diem contract was not something that she was interested in. In addition, we had 2 mid-level practitioners. We had Sarah Dickerson and Howard Croy, both who were seeing patients, Howard in our same-day clinic and Sarah in our Gold Beach clinic. Both declined a per diem position. and we wish them the best of luck in the future, and hopefully when this is all over, if they're still around, we can re-engage with them. And then as it would relate to other providers, we did have to sever our agreement with Dr. Geary, a cardiologist that we've had on staff. We will miss him dearly. And if you were a patient that was seeing Dr. Geary, we're notifying your primary care provider that referred you to him. And Southern Oregon Cardiology, we have met with them, and they are willing and standing by to assist. They are providing telehealth services for those that need to travel. And when this is over, they have agreed that they will return to CMC, and we have discussions about them providing some additional on-site services when this is over. As it would relate to orthopedics, we did have to end our agreement with Dr. Britt. And I do want to make everybody aware that Dr. Britt did not take call for our emergency room, although if he was available, he would consult with our ER physicians on occasion. But we have been transferring orthopedic cases out of our county to a higher level of care because one provider cannot cover the ER 24/7. It's an impossible feat for one physician, and we really don't have the demand for more than one orthopedic surgeon. To that end, we are in discussions with the orthopedic group to the north and also to the east of us, and they are both have expressed interest in coming here to see patients and performing surgeries here. So we hope that that will kind of fill the void of those tough decisions that needed to be made. I want to also say to many of you, and many of the questions that were submitted are about the frustration about losing your primary care provider. And I want to sincerely apologize for that. I would say that given these circumstances, it is difficult for all of us, and especially for the physicians and for you. And I wish I had a better answer, but at the end of the day, I really need to make decisions that will ensure that Curry Health Network will be here long into the future for you and your family's needs. We do have a number of physicians and providers that are still working full-time. And as you can see, if they're only seeing 45 patients a day, if you have a need for healthcare or to see a provider, or if you wanted or thought you should have seen your primary care provider, all you need to do is call our scheduling department. That number is 412-2000, and they will immediately schedule you an appointment either in Gold Beach or down at Brookings to see a provider. We are also offering telehealth appointments. And if you need a medication refilled, please call that same number, 412-2000, and our scheduling team will be in touch with the providers here. We have staff that are manning all of the needs of all of the patients that have always entrusted their care to us, and hopefully we will continue to regain your trust over the next couple of months. I would mention we do have an additional nurse practitioner that is planning to join us, and we're going to move forward with that. That'll happen in early July. She will be family practice down at CMC and also takes care of pediatric patients. So Dr. Harris is continuing with us, but looking for backup for him at some point in time. We hope that Dr. Harris gets to enjoy some retirement. Otherwise, the providers that remain are, and I don't really want to go through the list because I'm afraid I'm going to forget one of them. But basically, other than the ones that I shared are no longer with the network, are still here, and they are very, very willing and able to take care of our community during this time. I would say that we are definitely looking forward to the time when we can start rebuilding our network. I shared with you about Southern Oregon Cardiology's abilities, the orthopedic surgeons. We are also going to have a new podiatrist join our team later in the fall. That's a service that we've not been able to provide before, and we're very much looking forward to Dr. Brantingham joining our team. For those of you that have lost a primary care provider, or if you are under the care of Dr. Britt or Dr. Geary, you will be receiving a letter from us personally stating exactly what we intend to do to ensure your healthcare needs are met. And trust me when I say, I have been here for almost 5 years now, and I have enjoyed building this network and working with the people here, especially our physicians and providers. And it is nothing short of saying I'm sorry for this, and I sincerely apologize if you've been impacted, you and your family members, and we do intend to earn your trust and keep your trust going forward. A couple of other questions that were submitted about personal protection equipment. Curry Health Network does have ample supplies of PPE right now. When we learned of this and opened our incident command on March 6th, one of our immediate objectives was to conserve PPE. And I think the governor also had that in mind on March 17th when she gave us the order to stop doing all elective procedures. I would also say that it is our physicians that ultimately have the decision whether an individual patient should undergo a procedure during this time frame. And Oregon Health Authority has been very clear, and CMS just gave an update today, that physicians need to determine with their patients if in fact it's appropriate for them to move forward for elective procedures and cases. Administration does not make that decision, and I would just say that our physicians are looking at every patient on a case-by-case basis. So if you feel that you need to have a procedure done or that something should be done in a timely manner, please reach out to us. 412-2000 is the best way. And our specialists that remain here, or Southern Oregon Cardiology or the orthopedics to the north or south, are willing to assist during this time. I'd also be remiss if I didn't mention that Curry Health Network is so grateful for the donations and the support we have received from the community. To date, SOAB, which is the Southern Oregon Workforce Investment Board, has donated 1,000 N95 masks to our organization, and they've donated 5 gallons of hand sanitizer. And then an individual, Mr. Tim Tuttle, in our community has donated or is planning to donate 250 to 1,000 N95 masks, just depending on his supply chain and if he can obtain those quickly. I think that was it for what I wanted to talk about to make sure I covered things, and I'm just going to be consulting my my list of questions. There were questions about, in Gold Beach, with the departure of Sarah Dickerson, how will we cover our patients here? Dr. Manueli has expressed an interest. He's a physician that works down at CMC. He worked there 5 days a week prior to this hitting. He is very willing to come up to Gold Beach a couple of days a week to assist, and Dr. Lauder is standing by to accept patients and see patients, especially those that were assigned to Dr. Adams and or Sarah Dickerson. I kind of went over the refills and how we're approaching medicine these days, so there were some questions about that. We went over testing already. Are contact investigations being done? Yes, they are, but that's done by Public Health, not Curry Health Network. Tammy Kaufman asked a great question. She said, how much money do we need to raise in order to get everything back up and running? So we have done some preliminary forecasts about cash. And at this point, it would be prudent for me to say that they are forecasts. We are projecting that we will see in March only 60% of the revenue that we would normally see on average. And in April, May, and June, we're taking that down to 40%, and then slowly ramping it up. With our cost reduction plan, and without any support for funding from feds, the states, or other organizations that have been trying to help us, Curry Health Network would have run out of cash in June. I am really relieved tonight to tell you that Curry Health Network did receive a portion of the CARES Act. They distributed $30 billion directly to hospitals, and Curry Health Network received approximately $957,000 today. In addition, we've submitted our application and our loan for the SBA portion of the CARES Act, which we've been approved for $4.4 million. Of that, $770,000 is estimated that we will have to repay. but we won't have to start repayment for 6 months, and the terms of the loan are 1% interest, and it can be paid over 2 years. In addition, our CCOs have been great partners. Advanced Health and All Care, I can't thank them enough. They have been, they will be distributing early some incentive funds to every hospital that they work with where they have members. In addition, the Oregon Hospital Association, Oregon Association for Health Systems and Hospitals, distributed grant funds to hospitals. Will be receiving those funds at about $56,000. The Office of Rural Health has got grant funds that they'll be distributing, and so knowing the funding sources that we have and that have been committed to us, I feel very, very confident that Curry Health Network will be here now and long into the future. And I can't wait for the day where we have all of our providers too busy and not able to see everybody because we have a thriving organization. But that doesn't mean that healthcare will go back to the way it was. It will not. We have lessons to learn. Telehealth is a great option for a lot of people for follow-up visits. And I would say that in the past, Curry Health Network did not utilize telehealth services because the reimbursement simply wasn't favorable. It wouldn't cover the cost of that service. Medicare has changed those rules, and I'm hoping that Ginny won't get stuffed back in that bottle. And I hope that we can continue to use telehealth services, not only for our providers, but for us to connect with telemedicine for neurology and dermatology and for other things, psychiatry perhaps. I think that this is going to really change the dimension of Curry Health Network and how we provide services. And I don't believe that there's anything better than a reassuring hand on your shoulder from a physician. So I'm not saying that telehealth is the answer for all, but I do believe that there are circumstances where it can help us be more efficient with our time and efficient with your time. And I think that we'll see that evolve over time. I'm just reading some of the questions that were submitted to make sure I've kind of covered them all. Where do we get refills, person experience? We had an additional note from an individual about our prices that we charge versus what's on our website. I want to thank you for bringing that to our attention. We did realize that our website was not up to date, and we are in the process of updating that right now. And then it said, one question was, why did we stop doing non-essential surgeries? And obviously, that wasn't our choice. That was the governor's decision. And I have to say I support that decision because at the time we were planning on and still plan for some surge, but I anticipate we're going to get through this, and I look forward to those days. So I want to thank everybody. Please, next week I'm going to do the same Facebook Live streaming. Please submit any questions that you have in advance. I hope I've answered the majority of your questions, and if I didn't, please let me know that too. My email is publicknowledgevirginia.williams@curryhealth.org. Please feel free to email me directly. And I look forward to serving you and our community now and into the future. And I wish everybody would just stay well and take good care of yourselves. So with that, I bid you a good night.